Let's open with the truth. This is not a drill, and it's not a misunderstanding. This is a deliberate and brutal attack on the poor, the elderly, and the disabled, done to free up billions in tax giveaways for billionaires. Republicans said they'd protect Medicaid. They lied. And this is their blueprint for betrayal. For years, Republicans claimed they had no interest in touching Medicaid. They told seniors, parents, and caregivers not to worry. But now, here it is, $880 billion in cuts, dressed up in deceptive language and rushed through committee under the radar. This isn't an adjustment, it's an assault, and the goal is to make it law before the public can fight back. We're sounding the alarm now, because this is the plan, and it's real. This bill doesn't help working families. It doesn't address deficits. It slashes healthcare so the GOP can push more tax cuts for billionaires. It's not fiscal policy, it's class warfare. Poor people lose care. Rich people win loopholes. This is a reverse Robin Hood budget. Rob the sick to feed the super rich. They know direct cuts are unpopular, so now they're trying a quieter weapon, red tape. They make Medicaid so hard to navigate, so buried in rules and requirements, that people give up. That's not bureaucracy. It's a deliberate tactic to reduce enrollment without ever voting to do it. It's cruelty hidden behind forms and fine print. This isn't about encouraging employment. It's about disqualifying the vulnerable. The GOP wants you to believe they're targeting freeloaders, but in reality, this punishes people with mental illness, chronic conditions, or unstable jobs. It punishes single parents and unpaid caregivers. If you miss a report or fail to meet the 80-hour threshold, you're kicked off. This is a trap, not a path to opportunity. When you live on $800 a month, a $35 copay isn't reasonable, it's devastating. This proposal would force low-income families to choose between buying groceries or going to the doctor. It's not cost sharing, it's cost denial, and it's a calculated move to push people out of care to cut costs and justify more billionaire tax breaks. One of Medicaid's most humane policies is retroactive coverage. It protects people in medical emergencies. This bill slashes that window from 3 months to 1. If you're hospitalized before applying, tough luck. You could wake up to tens of thousands in bills. This isn't trimming fat, it's throwing vulnerable people off a cliff. $880 billion isn't just a budget number, it's home care gone, it's wheelchair funding gone, it's meals, medications, and human dignity gone. These cuts are big enough to wipe out care for 3 million elderly and disabled Americans. Services that keep people alive and independent will vanish. And why? So the ultra-rich can squirrel away even more in untaxed wealth. This is redistribution, but upward. Don't let them tell you otherwise. This bill guts Medicaid expansion, and millions of adults with disabilities rely on that exact program. The GOP claims they're protecting the vulnerable, but their policies betray those words. The truth? They are targeting the disabled. They know who gets hurt, and they're doing it anyway. This is how you dismantle a safety net. You eliminate retroactive coverage. You ban the tools states use to fill funding gaps. You choke off in-home and community-based services until they vanish. It's not one big cut. It's dozens of small incisions designed to make Medicaid bleed out slowly while pretending it's still alive. The bill doesn't call it a block grant, but it functions like one. States get a fixed pot of money, no matter how many people fall into poverty, disability, or disaster. That means rationing. That means people fighting for crumbs. That means a Medicaid Hunger Games where only the lucky or well-connected survive. And those who need care most, they're the first to be sacrificed. This isn't accidental. It's part of a coordinated right-wing campaign called Project 2025, a roadmap to privatize and gut public services. Their goal is to turn Medicaid into a shell. No guarantees, no dignity, just blame and bureaucracy. And this bill reads like their instruction manual. If we let them win here, they won't stop until every public good is up for sale. If you're a senior who owns a modest home, this bill says, sell it or suffer. In high-cost areas like New York, LA, or Seattle, home values alone could disqualify people from getting into a nursing home, even if they're broke, even if they're sick. This is punishment for growing old in the wrong zip code. It's theft disguised as reform. Republicans call this a common-sense bill. There's nothing common sense about denying healthcare to people in crisis. There's nothing responsible about forcing families to choose between bankruptcy and survival. This is not simplification. This is strangulation. Don't let their branding fool you. This is a full-scale attack on human life. Let's stop softening the language. This is a war on poor people. It's a war on disabled people. It's a war on seniors who can't afford a private retirement. And all of it is being waged so billionaires can dodge a few more tax bills. The GOP has picked a side. It's not yours, it's not mine, it's the ultra-rich, and they're coming for the rest of us next. This is the moment. The vote is coming. May 13th is when it starts moving. If we wait until it's on the House floor, it could be too late. Call your Republican representative. Demand they vote no. Post about it. Write letters. Organize. This is our shot to stop something catastrophic before it becomes law. Let's make noise while we still can. This is how we win. Pressure. Call them, email them, tag them, demand that they stand down. If they don't, remember it. Organize around it. We are not powerless, we are just getting started. And together, we can turn this outrage into resistance.